There we go. I was playing around with that funny mask earlier and it wasn't working out too well, so we just rebooted. But I want to hop on today because I've been getting a lot of questions from a lot of different people where they're just wondering how long should they give their therapist or their practitioner or their chiropractor or their whoever it may be before they start to see results. Because I've had an influx of direct messages where people are saying, I really like this person though, like their theory makes sense. But Ron, what's going on, man? But they said, I've been working with this therapist for 60 days. I've been working with them for 90 days. And I think I'm better, but it's hard for them to really know 100%. So I wanted to kind of just cut to the chase. And for you that are watching live, feel free to comment live. And for those that you go back and watch replay, just go and tag yourself in replay and comment in that way. And I'll be sure to go back and answer the questions. But, this is really important because time is so important for people nowadays. We're on the fly, we're busier than ever, and we really don't have the time to go see someone 3 times a week or even once a week for months and months and months if we're not seeing the benefit. Now, certainly there are cases where we want to manage the pain. We want that kind of long-term maintenance, and for me, it's not as much just maintenance, but that ongoing progression in their care. For me personally, though, I think you should start to see results after about 30 days or within the first 30 days of working with your practitioner. And that's something that we at Pr1me offer and tell everyone within the first 30 days. Since we feel like this is something we can help with, we'll be clear with that. We will give this 30 days to make sure that you can start to feel the progress and the progression, that you're on the right track, that you're moving forwards. Because I hear people that are working with someone, and again, this isn't just therapists that I'm going to point the finger at. Really, anyone who's being your kind of healthcare practitioner that says, hey, I can help you with this pain, I'm kind of putting them up for responsibility, because the healthcare world's tough. It's a business side of things, but we need to be ethical and moral. And we need to make sure that we are truly helping someone. And granted, there are tough cases, but within the first 30 days, or for us, that's probably somewhere between 4 to at a maximum like 8 visits. They should know they're on the right track. What we're saying makes sense, and they're starting to feel the difference, and they're starting to make progress. If you feel like, yes, it was a great plan, everything made sense to you, but you reflect after 30 days and you feel like you were no different than where you started, I would suggest that you reach out and find someone else. In the healthcare world, it's important that you find someone that you trust, and once you find someone you trust, it's hard to kind of steer away from that, and it's hard to go fishing and to put more energy into finding someone else that you really trust. But I would say, just consider, especially on the therapy side, because I know I can speak for that, for our practice and our autonomy, physical therapy is not created equal. When people say, sorry, that guy's jamming over there. Jeez. People will say, I received physical therapy, and you'll hear me narc on this all the time. You saw a physical therapist, all right? And then under the environment that they're working also is a variable. Like, if it's more of a corporate world, they might have been seeing you and 3 other people in that first hour. And just because you're one-on-one with someone doesn't mean that you gave it your all, okay? Because then it depends on the type of physical therapist and what their background was and what they tried working with you. And you should be open to receiving other opinions and other opportunities and working with other therapists. And heck, I would go up to 3 to 5, and I would really kind of be a consumer. You are a consumer if you are in pain. You have to remember that. Granted, you want to find a doctor and a healthcare practitioner that you can trust, but you are a consumer. You can go out and I'll use the word shop around. You can go find someone that really makes sense to you, where you connect with them, their theory makes sense. I would really prefer, if I was a customer and consumer, to have one-on-one care. It's not absolutely vital, but I would strongly suggest that you would steer more towards a one-on-one setting. At least for us, it's a full hour, because we hear about different practices all the time that are one-on-one for a half hour. And to be honest with you, that's just getting started for us. First 20, 15 minutes sometimes is just sitting down and just discussing how your ergonomics at work. How are you walking? Are you doing the exercises? Let's review those. And then we want to leave some time for some hands-on care. And then after we do the hands-on care, we might reintroduce or introduce a couple new exercises and progress those in those ways. And then we want to make sure you can master those exercises before you go. So we happen to be really particular in that way. And You just want to know that you're on a good track. You want to know that you're working with a professional, a practitioner that's giving it your all, and that's personable with you, that you don't feel like it's treated like a billable number. And so I just want to hop on this beautiful Saturday afternoon just to talk to you guys about that, because I think a lot of times people feel like they're just stuck. They're stuck with someone, they trust them, they've spent a lot of time and money with them, they don't want to go anywhere else. But have you gotten the result that you're opting for? And it's starting to be a really nice golf season. Are you able to get out and golf the way you want? Are you able to get out and go walk on the beach? Or are you still limited and mindful of your painful hip or knee? These kind of things that I want you guys thinking about. So yes, I'm challenging the healthcare practitioners out there to stand up, to be better, because in my world, it's technically almost a red flag that you haven't progressed at all within 30 days. Sure, there'll be some forms of awareness that you'll have improved, and you should have had a decrease in pain. If you feel like, listen, if someone comes to me and says, Dr. Kuntz, I'm the same as what I've been after 30 days with you, which, by the way, we would have picked up much earlier, because I like to reassess all the time to make sure that they're getting better. But let's just say I really missed the boat on this one. They said, I haven't got any better after 30 days. Then that's the time, not only for me to recheck my math, but to recheck my customers' math, that they've really been doing their homework, they're doing the exercises, doing the best they could. And then it might be time to go get an x-ray. Then it might be time to go get an MRI. Then it might be time, if we really had to go get a corticosteroid. We tend to want to avoid that as much as possible, but there is a time and a place with that. But for us, we will never really get to that surprise moment after 30 days and be like, oh, wow, you've never gotten better. That's because we're routinely assessing and reassessing you every day. So, at that point in time, if you come in and you're dealing with shoulder pain, if you're just having trouble raising your arm up overhead, I'm going to be reassessing that every time you come in. And then before you go, did it make a difference? Did it help? And then you come in the next time, we see if we got that carryover that we were looking at in between appointments. Same thing. Did it get better? Did it not? I think the slippery point is when people get so busy, they're on phone calls, they're filling out paperwork, documentary, whatever it may be, and they don't have time to reassess you. That's when things get slippery, and that's when it's like, oh crap, it's been 30 days. How do you feel? It's like, well, I'm not getting any better. So anyways, guys, rock on. Just had a good workout. A girl was sleeping, so just want to hop on and just talk about how, yes, you guys are still a customer and a consumer out there in the healthcare world, even though you may not think of it like that. Feel free to shop around, and not necessarily in a monetary way, but finding the results that you're looking for, right? It would make sense for me to take my car to get alignment every 3 weeks if I had to pay a cheap fund, but I had to keep going back to get the alignment. Like, what's the point of the money? So more so that, find someone that you can trust, find someone that you've got a good environment, give them 30 days, be critical, be a consumer, and somewhat be skeptical too. Like, find the answer, make sure you find someone that can really help you, and then let them prove that within the 30 days. And if you're kind of even on leeway, you might give them up to 60 days, but it should be somewhere around there. So thank you guys for tuning in. Feel free to go back and watch this if you need to. As I post the replay, feel free to put any comments, and enjoy your blessed day, guys. Thank you so much.